we're going to talk about a patient during treatment where you might say to me, Glenn, how would you use this sort of to not necessarily modify my therapy, but complement my therapeutic approach and monitoring? So this is a traditional complex patient, 74, history of competing diagnosis of smoldering myeloma that had been treated, so a modulated immune system, also a history of ANCA-vasculitis, so was off immunosuppression. Why is that relevant? Think about that. That means HPV virus is growing up and cancer is growing up in an immunosuppressed individual, and many of you know that that's a more concerning situation. So this patient was staged initially, or underwent surgery because we were hoping to avoid, praying to avoid chemotherapy. We knew he was going to need myeloma therapy and didn't want to subject him to long-term neuropathy. So he goes to surgery with traditional TORs and ipsilateral neck dissection, and unfortunately, as you see there, his disease is ugly. I mean, this is you wouldn't look at this, I guarantee, if you're honest with yourself and think this was an HPV positive patient based on that scan. This looks like an ugly sort of multi-station, minimally or largely necrotic but not cystic nodes in the neck, which looks HPV negative, but this was HPV positive, and the patient underwent platinum radiation, unfortunately, because as you can see, there was more disease than met the eye at the time. He says grossly ENE positive, multiple lymph nodes, and we were very concerned. So this was his NavDx trend, and I'm fully admitting that I was using it a little bit more aggressively than I normally do in this setting. He was detectable at baseline, and you can see those first time points were actually post-op. So look at him, and Chris brought this up. This was immediately post-op. He was 11. That made me very concerned. The fact that this man went to TORs, I would have, and I'm saying this in all honesty, even if his path had recommended radiation, I probably would have given him chemoradiation or offered it for a positive NavDx in his situation, post-op, given my experience. And I followed it very carefully, and you'll see ultimately he did clear, and I'm watching it very carefully. But that's just a flavor of how you might use it. Again, it not necessarily is going to change your guideline management, but it might inform your decision making about whether or not to tip the scale towards chemo, or whether or not you get an image or see someone back a little more frequently, or how often you're sort of visualizing them. So this was a recent case of mine, and we're still following him, and he's now out of treatment.